scientist. And she joins us also from Columbia via the University of Toronto. And some of you may not know that I'm Canadian. This may not have come up.
We don't know where to.
Yeah, so, yeah, nice, thanks, Colin. Yeah, yeah, you should have the t-shirt, yeah. So anyway, Bianca will introduce herself. As you can see, Bianca is also a representative of the Apple company, and yeah, ready to go?
Thank you.
Awesome, thank you, Bianca. No worries.
Computers just to be on the same side, so it was a good thing
Yeah.
because.
Big ideas, it takes two computers.
Yeah.
Thanks, Bianca.
Great. Thank you so much. I'm really happy to be here. As you'll see from my presentation title, Uniting Public and Planetary Health for Food and Nutrition Security. It's a big title. What does it mean? And I say we because I'm part of the public health community, global health community, planetary health community. So what does that really mean in terms of collective action as we are unfortunately facing new realities? And so I'll start with an introduction. And I'll start with a positionality statement, which you probably know what that is, but it's essentially based on the presenter's race, class, gender, identity, other experiences and privileges, based on the idea that my research can be intentionally or not intentionally influenced by my identity. And so in the spirit of reflexivity, I grew up in Toronto, Canada, very multicultural city. My ethnicity is European. My mom is from Greece and my father's from Italy. And on both sides of my family, growing your own food and being very connected to your food systems was an aspect of my upbringing that I think I really appreciate now, you know, years later. But that specific aspect in terms of nutrition was really where I saw myself at a very early age. I just didn't know what part of nutrition I wanted to make an impact on. I knew I wanted to be in nutrition, but I didn't know exactly what focus. So with that, I did not one, but 3 degrees in nutritional sciences. And I did a bachelor's and a PhD at University of Toronto and a master's at University of Guelph. My doctoral dissertation was looking at the role of the food environment on diet-related health outcomes in school-age children and adolescents in low and middle-income countries, using Pakistan as a case study. And so that's a very, very long dissertation title. I seem to like that, but Dr. Zalfa Carducci was my mentor for my PhD. And that really opened my eyes to the world of food systems and food environments, which I'll get into a little bit later. As Jim mentioned, I'm a postdoc scientist at Columbia Climate School. Prior to this, I was also a postdoc fellow at Johns Hopkins University in the Bloomberg School of Public Health International Health Department. And prior to starting my PhD, I also worked in public and global health for about 7 years on effective nutrition interventions and capacity building initiatives. In terms of skills, I'm trained in quantitative research, including survey methods and evidence syntheses, but more recently in a lot of my work, I'm looking at epidemiological studies, ecological studies, as well as in implementation science. And then finally, some achievements. So my time at Hopkins was funded by the Canadian Institutes of Health Research Banting Fellowship. And then I also received the IDRC Food Systems Award in 2021. So I'm going to put up a few definitions here. I'm sure you probably know the first two anyways. And I think it's important to kind of set the scene and give you insights in terms of the nuances between the definitions before we kind of get into the nitty-gritty. So of course, public health is the science of protecting and improving the health of people in their communities, obviously within a certain jurisdiction. Global health is an area of study, research, and practice that places priority on the health and improving health equity of communities worldwide. And of course, this transcends national boundaries. And then finally, planetary health, which is a definition that came out in 2015 from the Planetary Health Alliance. It's more of a solutions-oriented, transdisciplinary field and social movement focused on analyzing and addressing the impacts of human disruptions to Earth's natural systems on human health, and life on Earth. And so I think these are important because as you work within the field, you will start to notice that these lines become blurred in terms of what's public health, what's global health, what's planetary health. And a lot of the students that I currently work with, are often confused by the definitions. But I think it's important in terms of where our world is heading in terms of climate, conflict, pandemics. And so wanted to set the scene here. So as I mentioned in my introduction, I worked in public and global health for about 7 years, and I wanted to give a couple of examples. So firstly, in my master's, I worked on an intermodal reliability of a nutrition screening tool for children. And what this is essentially a parent-administered 17-item questionnaire that parents fill out based on food and nutrition intake, physical activity, the feeding environment, growth and development. And my mentor at the time, Dr. Janice Randall Simpson, was the one who developed this NutriStuff questionnaire. But in 2012, Dietitians of Canada really wanted to convert this questionnaire to be in an online format so it was more accessible for parents to fill out. And so my role as a master's student was to figure out, was the paper-based questionnaire and the online format reliable and intermodal reliability to ensure that parents are answering the exact same questions the same way as they would if they're doing it on a paper format versus online format. And I'm happy to say it was reliable. But that was my entry point into surveys and nutritional sciences. And so that was the first undertaking. And then from there, for my master's, I joined SickKids Center for Global Child Health, where I worked on a number of systematic reviews and scoping reviews, like ad nauseum. This is 3 examples here, but there are more. Zinc supplementation for infant outcomes, fortification of salt with iron and folic acid, iron and iodine. And then the Lancet Child and Adolescent Optimizing Series, which looked at 12 different systematic reviews and what works from 0 to 19. In addition to this, I did a lot of capacity building work. So I developed this online open access SickKids Public Health Nutrition course. And at the time in 2014, there were very few public health nutrition courses that were available to health practitioners in low and middle income countries. And so the objective of this was to make it freely accessible and that, nurses or a physician could pick it up and learn a little bit about public health nutrition. And then from there, we decided, okay, how do we actually blend this learning to be both an online format, especially where they're resource limited settings, to be also an in-person format. And so we worked with the International Pediatric Association to deliver blended learning in Indonesia, Kyrgyzstan, Pakistan, and Panama. And then finally from there, we took some of that e-learning modules and pared it down and made it more context specific to health facility and community health workers in Kenya, Uganda, and Tanzania. And this was another really, I think, pivotal point in my career in that when delivering this type of in-service training, many of the health facility and community health workers were, I would say, quite confused because nutrition was often thought as a health systems issue. And oftentimes they would, during the pilot training would say, nutrition is not just an issue for the health system. It is an issue for Ministry of Agriculture. It is an issue for Ministry of Water, social protection, education, but there is not this crosstalk. And I found that very interesting. And, kind of got my wheels turning of where I wanted to be and what I wanted to do. I was contemplating a PhD at that point. And I kind of realized I needed to put more tools in my toolkit. Just knowing nutrition from a health systems perspective was not enough for me, and that I needed to understand it from a different lens. And so, again, around that same time, this particular commentary came out in the Lancet from Richard Horton and colleagues, looking at From Public to Planetary Health, a manifesto. And they mention that an urgent transformation is required in our values and our practices based on the recognition of our interdependence and interconnectedness. And that was kind of a light bulb moment for me, and thought, okay, if this is kind of where our world is heading, how do I, pivot myself or do a PhD in something that is still nutrition focused, but looks at it from a different angle. And another commentary was published in 2022, again, on World Health Day, which reiterated the same sentiment: no public health without planetary health. And again, I thought that was super interesting. But when you think about these two large disciplines, in order to bring these closer together, you ultimately need some type of systems thinking. So complex questions like solving hunger in SDG 2, they're inherently multidimensional, and they're often framed in reductionist ways in order for us to understand them. But systems thinking is not something that's easily taught. It's not kind of this off-the-shelf method that everybody can just use and implement whenever they feel like it. It takes a lot of work to understand multiple perspectives, analyze synergies and trade-offs, integrate insights into your analyses, and receive a more comprehensive understanding of your problem. And so I felt that, systems thinking was, something that I really wanted to dive into, challenge existing paradigms and boundaries, and think of nutrition in a different way. And so today I'm going to talk about the kind of three overarching research stream that my research has now fallen into. The first being drivers, second being transformations, and the third being convergence. And I have 5 to 10 projects under each of these, but today I decided to just choose one from each research stream, kind of delve deep into that. I'm happy to answer questions about anything else that might be interesting, and talk about that further. So the first on drivers, and this is very much empirical in nature, looking at how cultural, economic, and environmental drivers shape dietary patterns and inform strategies for nutrition. The second one is looking at what types of interventions or large-scale transformations exist that are triple wins in terms of environment, justice, and nutrition. And then the final one is, how can we infuse nutrition into policies and programs by bringing together multi-sectoral stakeholders? And in particular, this research stream really looks at climate and conflict. So the drivers of nutrition. So the two main research questions that I look at is, how has globalization and related economic factors shaped food systems and ultimately diets and nutrition? And then second, how does climate change and climate variability impact diets and nutrition? And so I have two kind of sub-research buckets under that. I'm going to talk about the Pakistan study specifically, but I'm also working with DHS right now on the climate and women's dietary diversity, because DHS has now started to collect minimum dietary diversity for women. And so we're trying to see sort of what climate variables, as well as, middle supply chain, food supply chain, market level, and then household level factors influence minimum dietary diversity. And so in order to talk about nutrition transition and sort of where our world is heading, I'm sure this is probably familiar to you, but this is the conceptual framework developed by Popkin in the late 90s, early 2000s, looking at how nutrition transition has shaped and changed traditional diets all the way to westernized diets. And this shift in highly processed foods also came with a rise in sedentary lifestyles. And so while undernutrition and micronutrient deficiencies are still the focus of many developed agendas in low and middle income countries, we know that accelerated globalization and other economic related factors, as well as changes in how people obtain their foods, whether it's from supermarkets, from informal vendors, has ultimately changed the way that our diets and lifestyle patterns look today. Now, in today's world, I think we're actually seeing more of a mosaic. One of my colleagues, who I don't think is here today, Anshi Lo, and I worked on a paper earlier this year looking at how food systems and nutrition related outcomes kind of cluster across the world. We're hoping that will be published soon. So I can't say too much about that one, but essentially what we're seeing is these 5 patterns may not actually exist in today's world. It actually might be a mosaic of sort of what we're seeing across and within countries. And so to kind of give you a quick objectives of what this survey looked like in Pakistan, it was part of my dissertation. It was ultimately to design a novel survey tool that examined the retail food environment in terms of key constructs in a peri-urban district of Pakistan. The food environment is a concept that describes the collective physical, economic, policy, and sociocultural surroundings, opportunities, and conditions that influence people's food and beverage choices and nutritional status. So this definition was developed by a group in Australia, in the Informist group under Boyd Swinburne, to kind of look at sort of how people are obtaining their food, what are the influences of obtaining food and beverages. And so for my survey, I really wanted to look at key food environment constructs, food access, food availability, and food promotion of food outlets by village size. And so the particular area that we designed this survey for, we had a long-standing relationship in Matiari. There was a previous cluster randomized intervention trial that delivered supplementation and life skills to adolescent girls and young women. And so we knew the community well. And we already had collected data on food insecurity. And so that kind of helped us in terms of designing and a sampling strategy that was stratified by village size. And so you can see that here. So we divided our sampling frame based on small villages, medium villages, and large villages, thinking that the small villages will probably be more traditional in nature, probably still more or less hunter and gatherer, or growing their own food, whereas the larger villages closer to city center would likely be more on the westernized side of the spectrum. So in total, we sampled 224 villages and 1,484 food outlets. Now, the initial survey design was based on 2 kind of activities. The first was a literature review to understand which metrics we should include within this survey. But at the same time, we also hosted a food environment workshop in January 2020 with 50 food experts from across the world who kind of gave their recommendations on what should be included within this survey design. So with that, I developed the first survey tool. In February 2020, we pre-tested the survey tool within 90 food outlets within Matiari district. And then we revised it based on cultural context and, maybe some of the questions weren't worded exactly right. And so that was the second version. The third version, unfortunately, was revised because of COVID. And we realized that we could not probably implement all the metrics that we had initially wanted. We initially wanted to collect data on cost because that's really difficult to find. There's a gap in understanding cost of food. And so we revised and pared down the survey even further and had to train field teams over Zoom because I was not allowed to travel. And we had to wait until October 2020 in order to actually implement the survey. So it was a bit of an unfortunate circumstance, but I think we made it work as kind of the first initiative of looking at the food environment in Pakistan. And so what we see here is based on the type of food outlets, whether it's a restaurant, a specialized food store, like a butcher or a bakery, a corner store or mobile vendors, what we see is based on all the different food groups that we collected, that corner stores were sort of this one-stop shop for both healthy and unhealthy foods. And that was really interesting because regulations and policies around corner stores don't really exist. And so we thought to ourselves, okay, in terms of, where this project could lead to, how do we essentially look at corner stores more closely? So that was the first finding. The second finding was that we thought that small villages would differ significantly between certain food groups compared to medium or large villages. And so what we saw was, except for vegetables, fast food, chips, and confectionaries, all other available food items differed by village size. And this signals that where, in small villages where you would expect reduced availability of unhealthy foods, there was actually urbanization and, modernization occurring in these smaller villages. So fruits, nuts, meat, poultry, water, and sugar-sweetened beverages significantly differed by village size, as well as legumes, pulses, eggs, fish, meat, and juice. And so the findings of this survey, of course, it was conducted during COVID, and we don't know if maybe that impacted where food was being sold, and maybe corner stores were just easier for people to get food at that time. It did not appear that food access and availability were disrupted from the point of access, but access can also be measured in terms of economic access and social access. And so that was something that was originally in our survey, but we had to pull out. And then secondly, as I mentioned, because corner stores were sort of this one-stop shop for unhealthy and healthy foods, this might be an important entry point for policy. So moving on to transformation, I will talk about one project under Transformations for Nutrition and explain sort of what transformation means. So the first research question that I'm working on is around food system interventions for improving economic, health, and social outcomes, especially for food system actors. Number two, how can we measure performance of food systems to measure transformational progress? And then third, can we improve current crop model, which is a little bit of an offshoot. It's a project that was funded by the US State Department, the VAX project. How can we include nutrition dynamics within these crop models that are traditionally used to measure yields, for example, yields of staple crops, which are not necessarily the most nutritious. So how do we include nutrition dynamics within these crop models to ultimately predict what will happen 10, 15, 100 years from now? And so in terms of kind of where these projects sit, so the first research question falls under Eat Lancet 2.0. Second one under this US State Department Vision for Adapted Crops and Soils. And then the third one, Food Systems Countdown Initiative. And I'm going to talk about the last one because we've submitted manuscripts to the other two, and I'm not allowed to talk too much about the finer details, but I can kind of give a brief overview of this. So food systems transformation, what is it? So in 2021, the UN Food Systems Summit focused global attention on food systems that likely wasn't there before. And there were 6 areas for concerted action across actors and stakeholders. So incorporating food systems transformation in all national policies, establishing multi-sectoral, multi-stakeholder food systems, investing in science, research, data, and innovation, deepening inclusive design and implementation, promoting engagement of businesses and accountability, and then ensuring access to finance. And so transformation on a global scale versus a local scale looks very different. And that's something that has come out in the Eat Lancet publication, is that transformation in one part of the country might look different than another part of the country and might look different across regions. And so how do you sort of advise policymakers to make shifts or kind of give a blanket recommendation if there's so much nuance that exists with food systems transformation? However, at this food systems summit, there was no monitoring framework that was agreed upon. And the SDGs are insufficient to monitor food systems. And so there was this large gap within the space of how do we monitor transformation if we have no indicators? And so the Food Systems Countdown Initiative emerged out of that. And it is an interdisciplinary, multi-institution scientific partnership. Over 60 experts sit on this initiative in terms of meeting SDGs and other global goals. And it provides actual evidence to track progress and guide decisions for transformation. It complements other monitoring and tracking initiatives. Some of the indicators are actually included within, in SDGs are included within the initiative. And it contributes to advancing science of food systems and their transformation. And so in terms of the timeline, we had an initial article that came out as a viewpoint. Over 2021 and 2022, we went through a very large list of indicator selection. We started at like 550 indicators and moved our way down to 50 indicators, through different criteria and country consultations. In 2023, we published the first baseline paper, which I'll show you some results from. This year, we're publishing an interactions paper. So how do the indicators interact with one another, and where do we see synergies or trade-offs between the indicators? If one is moving in the right direction, but 10 are not, what does that mean for food systems transformation? And what I'm currently working on is the 2025 paper right now on performance. So I'll talk a little bit about that. So the indicators fall into these 5 broad themes. First, diets, nutrition, and health. And then you can see there's sub-dimensions: food security, diet quality, food environments. Theme 2 is on environment and natural resources. Theme 3, livelihoods, poverty, and equity. Theme 4, governance, and theme 5, resilience. I will say theme 5 is the hardest in terms of indicators, because it's more or less a relatively new concept for food systems transformation, and identifying good indicators that are collected by at least 70 countries across the world, have frequently updated data, is quite challenging. We're kind of looking at this group right now in terms of one of the indicators. It's ratio of damages to GDP, and ratio of damages from climate change could be because of where your country sits in the country, or it just might be because of climate change itself is kind of widespread. And so this indicator is not a great indicator, and so this is kind of what we're dealing with right now in terms of changing some of them. So some of the key findings from the State of the Food Systems baseline was that no food system has a monopoly, or success is not determined by the country income group. And I think this, again, was another surprising finding, because you would assume that high-income countries are doing amazing on all of these indicators, but they're not. In terms of environmental outcomes, they're doing horribly on environmental outcomes. And so this baseline really gave us a sense of, okay, where do we need to do more work? One of the areas is moving in a less desirable direction or a more desirable direction is not a great way to present this to countries and policymakers. So are there targets or other types of approaches that we can use to communicate that, okay, you might be not doing great on 10 indicators, and this is the absolute threshold that you should be meeting, whereas in others, you might not be. And so the idea for the next paper is essentially to identify reference points, whether these are targets or benchmarks. You really need to understand the data of each indicator and how it performs, especially time trend data. You need to develop a simple, transparent, and robust methodology that will be useful, but can also be simply communicated to policymakers who do not understand data. And there's also a level of expert consultation. And so we have country consultations planned after we develop these targets and benchmarks. And so the 3 sort of approaches that we're taking is the distance to target, or distance to a benchmark, whether it's a milestone or benchmark at a global level, a regional level, or income group level. We're looking at velocity. And so based on your latest data point or your historical rate, how much do you need to speed up in order to meet this target by 2030? And then finally, progress. And this is what SDG uses, is they calculate your current speed and what your current velocity is. And they say, if your current rate is maintained by 2030, this is what your food, where you'll be in terms of assessment. So you'll either be on target, moderate progress, marginal progress, stagnation, or regression. So we're taking these three approaches, but within those three approaches, as you'll probably notice, we can either choose a linear path, we can choose exponential paths, we can do very fancy modeling, or we can do something very simplistic. And so these are kind of the tough decisions we're making right now. And so I'll show you diets, because that's probably more useful for folks in this room. But the global target are targets that have been either set by SDGs or there are other sorts of normative guidance. So example, fruit availability. And so WHO has a recommendation of 400 grams per capita per day of consumption of fruits and vegetables. Obviously, proportion of the population using safely managed drinking water, we want to see that at 100%. That is an ideal target. Whereas when you look at global milestones, and this was a term that we came up with, it's essentially the top or bottom quintile. So the 20% average of the best performing countries within that indicator. And what you'll notice is that for most of the indicators, the global milestone is relatively close to the global targets. There's a few exceptions like MDD, children 6 to 23 months, that's at 59%, whereas the global target we would want to see 100%. And so this obviously brings in a question of equity and target setting. Is it appropriate for us to state that 59% is good enough for the world to try and achieve MDD? It's not, but this is what the data is showing us. When you look at distance to target, and I just chose fruit availability for today's presentation, you can see that Dominica is way above the target. So anything above is they have met or exceeded the target, whereas below, they are far away from the target. This is just a snapshot of 50 countries. The last country on this list, any guesses? No, the Gambia has the worst fruit availability. So it's kind of interesting to see the spread. It's quite interesting, and across indicators, it looks very different too. So that's something that we're thinking about. How do we present this in a way that policymakers will understand? So that's one metric. The other is velocity. So velocity to the target. So how quickly you need to speed up. You can use a compound annual growth rate, which is what SDG uses, or you can just use a linear. If you use the linear approach, this is, for Afghanistan, for example, they need to increase their fruit availability by 34.4 grams per capita per day. Is that something that policymakers will understand? Or they might say, okay, how do I increase 34 grams per day, right? And so that translation aspect is what we're kind of grappling with. Whereas if you use obviously a compound growth rate, 18% per year or 9% per year might be easier to communicate. But having said all this, one of the key pieces of feedback that we've received is that these 50 indicators are at a global level, and we can monitor them at a global level. But for national policymakers, context is critical. And in recognition of this, the Countdown Initiative, we've received a few grants from the German Development Agency and the UN Food Systems Hub to kind of take some deep dives into these 7 countries next year. And essentially what will happen is they will take these 50 indicators, see which ones make sense for their national context, and adapt them and hopefully monitor them. So that is looking at transformation. The final stream is on convergence. And so what is convergence? And so convergence, according to the National Science Foundation, is a means of solving vexing research problems, especially those focused on societal needs. And so you can see here, when you go from disciplinary, multidisciplinary, interdisciplinary, and convergence, you cross sectoral and disciplinary boundaries. There's integrated knowledge. It creates new paradigms. Oftentimes, this includes other communities, indigenous populations or NGOs that kind of come into the equation of science. So for nutrition anyways, how do we look at convergence across climate and nutrition resilience? And today, this is a relatively new concept of thinking through how does climate fit into the nutrition space. But if you break it down into the different sectors and sort of what are adaptations that could be implemented, for example, if you're looking at humanitarian response, applying a climate lens through the humanitarian program cycle for nutrition and nutrition-related sectors and clusters, investing in agroecology techniques that safely and sustainably increase production of nutrient-rich foods. These are different actions that can be taken. They cross sectoral boundaries, cross systems, but today this is not really well communicated within the literature. And so we undertook a literature review that's forthcoming where this figure has emerged from. But just to say, convergence in the climate nutrition space is really not well documented. And so my current and past research questions, firstly, how can nutrition be integrated in multi-sectoral policies and planning, especially in crisis? And can climate information services inform nutrition policy and programming to improve preparedness and response? And so there's a couple projects under here. I'll talk about the last one, translating climate information to public health nutrition practitioners in Ethiopia and Indonesia. But some of the other pieces are systematic reviews or scoping reviews looking at integrated health and nutrition programming, what are the barriers in complex settings, implementation and effectiveness of school meal programs in complex settings. And so those are ongoing and submitted. So when we look at climate information and what is climate information, what does that even mean? Climate information exists across different timescales, which I'll show you on the next slide. But it has the potential to help address the Sustainable Development Goals numbers 2 and 3. Traditionally, climate information has been used for the ag sector to essentially influence growing seasons. And if you know that there is an impending drought or flood, you might change the way that you produce your food for that year. But for nutrition and nutrition practitioners, that hasn't existed within the literature. But it would be incredibly important in terms of better targeting certain interventions if you know a flood will be impacting a certain area, in terms of early warnings and preparedness, and then of course, long-term planning, investment and resilience. And so these are the typical timescales that climate change, and I use that word loosely because climate change happens over decades, whereas what we are specifically looking at in this project is weather and climate variability. And so these different timescales are interesting in the climate world, and how climate scientists speak is very different than us as nutritionists and what we think about in terms of response. So climate information services translates heat, precipitation, humidity, those types of data into some type of knowledge product to support decisions to manage climate impacts across contexts and sectors. And so traditionally, the energy sector has used climate information services, food, but less so the health system. And so there's a need for demand-driven climate information services for the health sector. This comes from the CDC, and it's an iterative approach that provides the use of climate projections to influence public health adaptation efforts at local or regional levels. And as you can see, it's circular, so it goes back to this sort of systems thinking. But in terms of the use of this for nutrition, I have not seen any sort of literature out there. And so this is sort of what we're basing our project on. It's this framework. So of course, we would forecast climate impacts, project disease burden. Oftentimes in health research, we see malaria or dengue. But for nutrition, what kind of disease burden are we looking for? And in our particular case, we're looking for wasting. Assess what public health interventions, develop and implement a climate and nutrition adaptation plan, evaluate impact, and there's this constant monitoring and learning. And so the context, we are, as I mentioned, Ethiopia and Indonesia. I was just there a couple weeks ago to kind of talk to our local partner, which is UNICEF, to kind of see which area should we start with as a use case. So which area of Ethiopia and Indonesia is experiencing both climate and nutrition vulnerabilities and could be so-called hotspot. So as you can see here from some of the nutrition statistics, wasting is very high in both countries. In terms of environment, Indonesia ranks second on the World Risk Index. And this index is used as a disaster risk tool to assess whether a country is more or less vulnerable to climate impacts. And it takes into considerations like cyclones, floods, sea level rise, for example. So Indonesia is doing much worse in terms of environmental context. As you can see, the number of floods and amount of people affected. But in terms of droughts, Ethiopia is obviously a different context. And so these specific characteristics are kind of helping us narrow down which parts of each country we want to use as a use case to kind of start the project. So in terms of objectives, the first is to map the nature and range of climate services that are currently available to public health nutrition practitioners. And we'll do that through an evidence review as well as key informant interviews in each country. The second will be to address and assess and address the local public health nutrition capacity building needs in these countries to use climate services. It needs to be understood by public health nutrition practitioners. And then finally, how can we strengthen their use or implement additional climate information that would be useful to improve wasting interventions in these communities. So we plan to do capacity building workshops sometime in 2026, and then produce a guidance tool. So in terms of future research streams, these are kind of, again, the three broad categories. Numbers 2 and 3 are fairly similar to what I'm working on now, but they will take a little bit of a different focus looking at specifically children and adolescents. So I'm working on a few different grant proposals for that one. And then the third one is looking at maladaptation and how do you prioritize nutrition while ensuring equity and justice. The first research stream is something new that I've been working on with colleagues in Thailand. Looking at how can you use AI for food environments to predict diet and nutrition burdens. A lot of this data on food environments, as you can probably imagine, is held by the private sector. And it is not publicly available, but they hold a lot of this information in terms of market insights or sales data that we as scientists don't have access to. And so how can you use open source data to ultimately predict what a food environment looks like and predict disease outcomes? In terms of some of my other work, so over the last couple of years, I've been doing some consulting with UNICEF, USAID, Nutrition International, and DHS, as I mentioned. And I think this is a critical piece in terms of influencing policy and practice. So in particular, Nutrition International was very interested at the end of 2023 of how to adapt their programming to include climate and sort of what were the gaps in their programming currently, or how could they kind of include climate in different ways. Whereas with USAID, I recently worked on a technical brief on climate and nutrition for the USAID programming. sort of, again, how can they include climate or ensure that there's actions that they can take that are multi-duty actions across their current portfolio. So in terms of where we're going, and how do we unite public and planetary health in sort of key priorities? So we need collective action across us as scientists and academics. We need collective action in terms of empowering people and educating communities, whether that's within the academic setting and including planetary health within curricula, or making resources accessible for all learners. And then thirdly, we also need to double down and bridge the gaps between our academic work and also policy and practitioners and communities. So we need to go further faster. And so collective action, I think, is utmost necessary if we want to unite the two disciplines. 30 disciplines, but will help as well. And with that, I will end and take questions. I know we only have 7 minutes left, 8 minutes.
We'll probably have a few minutes at the other end because I think we started a few minutes late, so people can stay. I think we're good. Thank you, Bianca. Any questions? I have a couple I could start off with if anyone else.
There were others.
I'm so sorry. Yeah.
Yeah, great, thanks for bringing that in this topic. Curious if some of your work around transformation and monitoring are kind of indicators. Do any of them involve adoption of the planetary health diet by different regions or countries? Or I know there's a lot of kind of debate about that, because if everyone did the planetary health diet, we wouldn't have enough food on Earth.
Right.
Listeners.
Yeah, that is a contentious topic. Let me see okay, it's on my other screen. So the Eat Lancet Planetary Health Diet that was recommended, I guess, in 2019, what the new publication that will come out, there was a lot of criticism towards that diet and tracking that diet across the world. I will say that there's been some improvements in terms of some of the numbers within the planetary health diet that you'll see in the new 2025 publication. But in terms of food systems transformation, no, we didn't include that as an indicator. Many of the, let me say this diplomatically, many of the experts on the
I'm infectious disease person.
Food Systems Countdown Initiative, they're not sold on that because they feel, why are you instructing people to eat certain things in certain quantities when they may not even have access to certain foods? And if meat is available to them, especially in Africa, why would that not be their primary decision versus here's a supplement, take a supplement in that? So there's a lot of disagreement about that. I think that's why this next commission report took like 2.5 years, because folks felt that it was a very patriarchy type of way of telling people what to eat and not what to eat, especially in low-income settings. And so we've taken a justice lens to the Eat Lancet diet now, and also added justice guardrails. So these are new boundaries that we have said that a diet and any transformation should take into consideration. For example, right to a clean environment or right to food. So these are some of the indicators that people should be tracking through Eat Lancet.
Yeah, the really interesting stuff. I mean, a couple of things. One, I was struck with when you're talking about the fruit availability, when you're looking at the small, medium, and large like villages, and starting at the top, like we're looking at fruit and vegetables, there's not a lot of difference, right? And so that I found that interesting because initially I was thinking, well, they're going to be supply chain infrastructure type differences that you're going to make. And then when you showed the composite with all the countries. You know, over here on the right, there were countries like Norway, Denmark, Finland, and I'm like, what the hell? You can't get fruit in Bergen, you can't get fruit in Helsinki. So what's going on with the way that you're kind of conceptualizing that? And then the second question, I'll just give it to you if you have time, is and you got to the sort of private sector. Private sector is just a gargantuan player in food. And I was really struck by this notion about how much data they hold. And, you know, in other contexts that I'm working in right now, mostly related to pharma, you know, there's some really interesting conversations going on in strategic management circles about new business models, about how to encourage the utilization of data to develop new business models that may end up being a little bit less exploitative than you know some of the practices that we're seeing. So any thoughts about one or other of those?
Yeah, so the first question about fruit availability. So the indicators in the food systems countdown initiative, that's based on the latest data point. So that actually might be later than when I conducted the survey in 2019. And so it's a valid question. Again, we looked at Planetary district, which is a very small part of Pakistan. So it would be good to see if Planetary in itself, you know, aligns with Pakistan in terms of fruit availability, or if there's differences there. And then in terms of your second question, it's a good one. Another thing I was recently working on was with USAID, looking at consumer demand for healthy diets. And there will be a report that's published sometime next week. And what does consumer demand mean? And how do we include micro, small, and medium-sized enterprises to improve demand for healthy diets? And
how to
so
incentivize them and stuff and get, you know, build markets.
there's different, you know, public and private partnerships that they could employ. You know, they could use resource sharing like distribution hubs or, and so there's definitely different models that could come into the equation for healthy diets. But in terms of the actual data and, you know, understanding, you know, retail value of ultra processed foods, for example, the private sector holds that data. And so sort of how do we, one of my key recommendations in that report that will be published next week is how do you synergize the public and private data into a new data ecosystem, because that could be very powerful for academics, communities, policymakers to see, okay, this is the public data we have, this is the private sector data we have, okay, how do we improve healthy diets in that aspect? I will say, working with Euromonitor, who holds a lot of this data, they're pretty resistant and they really have made us pay quite a bit of money for that data. So one of the indicators within the Food Systems Countdown Initiative is from Euromonitor. And negotiations are kind of happening now in terms of how can we include another indicator, and they're tricky conversations. Because that ultimately, it could mean that, you know, maybe one of their biggest companies no longer relies on them. And, you know, there's obviously implications of that. So I will say they're an important part of the equation. And I think the entry point would be through the micro, small, medium-sized enterprises in trying to collect their data.
Good, thank you. Any other questions?
Jim, this is Catherine online. Could I ask a question?
Oh, Catherine, yes. Can't see you guys, so yeah, thanks for.
Oh, there we go. I don't want to put the big picture on. Okay. Thanks so much for your talk. I really enjoyed it. I'm a social scientist trained in demography, and so that sort of prefaces my question, because there's been a lot of theory development and methodological development around systems, sociological frameworks, family systems theory, bargaining frameworks in economics. And so I'm wondering if you could, certainly relevant for your interest in equity. And I'm wondering if you could redo your study in Pakistan, given the challenges you had, and I think you eliminated some of the social variables. What would you include to operationalize relevant measures of equity in that context?
That's a great question. Actually, that came up in my dissertation examination. Some of the metrics that we don't have great data on are intra-household access of food and how food is equitably distributed within households. So if the male head of household is actually doing the purchasing, what does that actually mean for women and children that live in the household? Who eats first? You know, there's obviously literature on that, but I would have included, more social access and indicators in that sense. The other piece is economic access and who has money to be able to purchase food and make these decisions. I think we've seen in Planetary and more broadly across Pakistan, women are becoming more involved in food purchasing and other than food preparation, but food purchasing and making those decisions. And I think if we could have include those indicators, that would have been super important. The last thing I'll say, initially this survey was designed to look at school-age children and adolescents and sort of the immediate food environment around schools and within schools. But because of the pandemic and obviously schools had to close, that's why we pivoted to looking at the more broad-scale retail food environment. So I would say that, you know, even replicating the survey, but within a specific population group, that would also kind of give us an indication of food access and social dimension of access.
Thanks so much.
One over there.
I have a question about how you see yourself orienting in the future. So I think one of the cool things is that there are international trends in nutrition and food policy and, you know, things that we know are going on at a global level. And also making change in any of these things does oftentimes require very deep knowledge of context in a specific place.
Mm-hmm.
So it's cool to see across a lot of different places. And what I'm curious about is which region have you worked in most deeply? What is the context that you know intimately, and how do you envision orienting the future, trying to be in one place or kind of working laterally?
That's an interesting question. I've been thinking about that a lot in the most recent few years and thinking, you know, I've worked in so many different countries. Is there a specific area that I do want to focus on? I would say that I'm most interested in emerging economies. And so these kind of gray space or gray countries where they're kind of, you know, transitioning, but haven't transitioned fully. I'm interested in those, like, how can we stop the cart before it goes too far in terms of transition in a bad way, I would say. So how do we, you know, kind of implement policies in these emerging economies? I'm also interested in, you know, this peri-urban type of district. So they're not rural, but they're not urban, and also kind of focusing in more on that. It's difficult because, you know, working on a lot of these global projects, you're kind of pulled into so many different countries, and which is good because you can obviously see and understand nuance across countries. So I think that would be my preference moving forward, is kind of focusing on emerging economies and kind of more peri-urban environments.
All right, Bianca, thank you so much. That was
Thank you.
really, really fun and really, really illuminating. So thank you so much for that.
Thank you.
Reported for your efforts with lunch.
Great, thank you.
Oh, hang on, no, I don't know. Words. Here, 675, so we're back downstairs. That's a lot for you, Jeff. Awesome. Nice to see you, Jessica. How's it going?
Good, how are you?
Good, thank you. Oh, so. Just kind of drawn to, like, I would talk, where we talk about that. Because, like,